You're listening to the PT Pintcast, where smart people in healthcare come to make noise. Here's your host, Jimmy McKay.
Let's pay bills before we start the episode. You understand how this works. I want to say thanks to Brooks Institute of Higher Learning. They've been with the show for more than 3 years. They're the place to go for PTs who, when they're ready to level up their clinical game. Fellowships, residencies, neuro, orthopedics, pediatrics, geriatrics. There's more. I don't have my notes in front of me, but you've been hearing me talk about them for 3 years. Here's what you should do. Go to the website, brooksihl.org. I'll say it one more time, brooksihl.org. They've got amazing mentorship and leadership. Fantastic programs. I've never heard a person say a bad thing about going through the program. And you're located in Florida, and it's warm down there most of the time. So indulge, brooksihl.org. One of the most talked about leadership sessions at CSM 2026, we're about to get into it. We're talking about it. Under the bannership of leadership and innovation, 3 physical therapists from radically different career paths will now come together, like Voltron, to make a bold claim. PTs already have the skills to lead. We just haven't been trained to see it yet. In a session titled Leading with Care, Developing Physical Therapists, Potential in Healthcare Leadership, Todd, Lindsay, and Kelly connect the dots. It was my favorite game when I was a kid. Between what PTs already do and are good at in clinic and what's needed in healthcare leadership today and tomorrow and in the future. From therapeutic alliance to emotional intelligence, from clinical reasoning to strategic execution. The session will lay out for you, if you're coming to CSM, and I hope you are, how our profession can move beyond treatment tables and into boardrooms, startups, and systems level impact. Today, we're joined by those speakers. Let's welcome them to the show. Todd, Kelly, Lindsay, welcome to the show.
Thanks for having us, Jimmy.
Thank you. Yeah, super excited to be here.
I'm always curious because whenever there's 3 people with different backgrounds, and every good movie, if you think about it, is an origin story. How'd this thing come about? Who wants to say all right, here's how it's kind of like Three's Company. How did the Three's Company wind up getting together to go to CSM? All right, Lindsay's gonna take that one.
Yeah, so I'll take this. So I was at a different conference earlier this year, the American College of Healthcare Executives.
Oh, yeah.
And so the listeners may be familiar with that organization. They have an annual conference called Congress, and attended the sessions, spoke there, and then I was on LinkedIn afterwards just connecting with people who had attended different sessions, and I believe it was a comment from Todd on one of the threads, and I saw, PT, and then I think I saw Kelly and then MPT. I'm like, holy crap, there's PTs here, because a lot of times in those spaces, I felt kind of like an outsider, like, oh, who am I at this healthcare leadership conference? I'm a clinician. But I found the more and more spaces I got into, the more clinical leaders I found. Now, primarily those tend to be physicians, nurses, things like that. And so I was so energized when I ran into Todd and Kelly. And I'm like, guys, we got to bring a session to Congress again in 26. We got to present there, and we have to hit CSM. And that's kind of how the origin story, as you put it, began. And so it's been really great to get to know both of them. Like you said, radically different backgrounds. So we're really pulling from all of our different experiences and synthesizing it together for a really great session.
All right. And we'll get it for the audience. We'll get into the session. But any good podcast host, I don't want to just ask a lazy, well, tell us about your background. But since I teed it up and you volunteered, you started talking, I said you have radically different backgrounds. What's yours specifically? What's your 2 to 3 sentence sort of superhero origin story explainer?
So Army PT. I was doing my clinical rotations before applying to PT school, saw an Army nurse on a billboard and was like, do they have physical therapists? I Googled it. Turns out they do, spoiler alert. And I've been doing it for the past 15 years.
That's awesome. All right. So my next question will go with Kelly, then Todd. So the same question. Why'd you say yes? Kelly, why were you like, all right, did you feel the same sort of, hey, look at that, same people with some of the same letters, or why'd you jump in? Why'd you say yes?
So I attended Lindsay's session at the conference that she's mentioned, and was really impressed with what she did there. So when she reached out, I just thought, well, she'd be fun to work with. Let's see where this goes. And then as we talked, and it was a great topic. I think it's a great it's great information to share with fellow PTs out there. Some of it, and as we develop the information, I know I said several times, I wish I would have had a talk like this whenever I was a young new PT.
And that's when you know you're on to something, right? Is like, wow, they always say, like, write the book for you 10 years ago that you wish you had to get you through the last 10 years. So before we go to Todd, though, Kelly, what's your sort of background that comes here that's not like Lindsay's at all?
So I have been in pediatrics my entire career. I was a pediatric physical therapist, pretty much totally clinical the first 15 years of my career, and then transitioned into leadership this kind of last half.
Okay, so not a lot of babies in the Army, but maybe we're going to be forward thinking, and then we'll have more of that in the future. Now we'll come to Todd. Why'd you say yes, Todd? I know a little bit about your background. I know it's not like either of these women.
I mean, I just think it's so important because I've ended up in leadership and I didn't see it for myself. Sort of like what Kelly was saying, I didn't see it for myself. And here I'm at this conference and saw this post about Lindsay and like, whoa, there's another PT out here. I feel like I'm the only one, right?
Yeah.
And like, oh gosh, there's other folks. So let's connect and let's make this happen. And I actually think I told Lindsay and Kelly when we came up with this idea to do this presentation, like, we're going to have one heck of a story that this thing all started through a LinkedIn comment that we all got connected. That's pretty cool.
That is, I mean, I come from a comms background, right? So when you have a hammer, all you see in the world is nails. You said the word story. Those are the best presentations, right? Story with a meaning, not just up there to tell you about something without the meaning, right? That's why fairy tales, spoiler alert, that's why fairy tales, they're lessons wrapped in story, right? So those are in my opinion, those are some of the sessions. If you said, hey, do you remember anything from CSM? Actually, it's going to be full circle. My first CSM was LA. But do you remember anything? The only ones I feel like I remember are the ones where the presenters told great stories. So since there's three, usually one-on-one interviews are pretty good. 1-on-2, we got 1-on-3 on this one. So I'm gonna act like a hockey referee. I'm gonna drop the puck and you guys can fight who wants to answer first. Start us off with your session. We understand who's who in the zoo now. What's the big message or messages you want to deliver to PTs when we meet up in Anaheim? You guys are, by the way, Valentine's Day. So I got to be honest, if you want to make sure people like you and leave you good reviews, maybe some candy, maybe some Valentine's. That's just me throwing you some good ideas. But what's the big message you hope PTs walk out of that room with after your session?
I'm not going to lie. 100% was thinking this morning, I'm going to have to get some chocolates, like going
Good.
to Costco
All right.
before the presentation and coming with a big bag of chocolates for everybody. So now I think I'm committed to that. If you heard this, now I'm committed to bringing that bag of chocolates to Anaheim. But since we're in LA, I'm going to go and use a little bit of an analogy from Hollywood and from Disney in particular, because we're literally down the street from Disneyland at the conference. And in the Disney world, you have Star Wars now. And if you think about Star Wars and the Jedi, they all are strong with the Force, right? It's something that's inherent in them, but they have to be trained to become Jedi Knights. I think we are the same. Once you're trained as a PT, you have these skills, whether it's building the therapeutic alliance, whether it's thinking strategically about a care plan. These are all transferable skills that can make you a really great leader, but you have to take a little bit of training. You have to take some time to walk the path and develop yourself and understand the skills that you have and how it's transferable. And that's where we're going. We're going to show you what it is that you already have as a PT that you can leverage to become a great leader in your organization.
When people hire me for communications projects, I'm like, hey, thanks for paying me lots of money. Spoiler alert, the ideas that I'm going to give you are already in the room. I'm just going to pull them out. But that's I feel like part of your message, which is like these things that you maybe don't understand to be so powerful or transferable or important, other places are, and you already have them. And then I realized, Todd, I skipped over your superhero origin story. I want people to understand where you're coming from too. So let's do that right now.
Sure. Neither the Army nor pediatrics, although my wife is a pediatric PT. I started down the orthopedic and sports path, did my residency and everything. And then about 5-6 years in, and I work in Silicon Valley, so you interact with folks that are in the tech space. Met some folks that were interested in doing a physical therapy related startup and said, that seems interesting to me. I'm going to go and do that. That was back in 2016 and still at that today in the health tech space.
Love that. All right. So one of the core points is that PTs already have leadership skills. They just don't realize it. What clinical strengths translate directly, not indirectly, but directly to leading teams or organizations or being successful somewhere outside the clinic? Kelly, I feel like you said my first 15 years were clinical and then not. So we'll start with you. What clinical skills or clinical strengths translate directly that maybe you knew or didn't know, but all of a sudden you realize, oh, I've done this before just with babies?
Oh, sure. Well, so when you work with babies and children, you're also working with parents and
Parents.
caregivers. So,
Correct.
so you've got a lot of educating, a lot of training, a lot of, I think we have inherent motivation skills. We have some inherent sort of sales skills in order to get buy-in and compliance. I think even before that, though, we have to establish trust. We have to establish trust, um, and in collaboration with the parents specifically. And I think we do a lot of that in leadership as well.
Yeah. All right. Same questions for Lindsay too. We'll come back to you. What do you think are those skills that, hey, look at this. This actually works here well?
Mm-hmm. So the first thing I like to do when I meet a new patient is to understand them and where they're at. Where are they at? Where do they want to go? And what are the barriers to get there? And I think extrapolating that more broadly into a leadership space, that's all that we're doing. And so that's really where this clinical care as your roadmap to leadership began, because it was like, hey, like the things that we do in a clinical session where we establish rapport, we build the trust that Kelly was talking about, we problem solve, diagnose, build shared understanding, what's our action plan, how do I motivate them, get them committed to it, and then how do we monitor and adjust? So that's really the roadmap to your clinical success and also your success more broadly as a leader. So that's where we're drawing parallels from between those really kind of hallmark things that make a physical therapist successful. And that also translates to successful leadership.
Yeah, military, working with kids, and sports. I feel like there's so many sports analogies, our business analogies, or business analogies, our sports analogies. So Todd, you came from the world of sort of sports physical therapy. Was the path, was it as obvious for you, or did you figure out once you showed up outside of the sports realm?
I certainly think I took a lot of inspiration from sports in my leadership journey and understanding, like, what does it mean to be a team captain? What does that mean? What does the team captain do? What's their role on the team? And how do they lead the team from that position? But at the end of the day, I think Lindsay said some of this so well, is all these different things that we do as PTs. The one thing I think I'll add that we're going to talk about in Anaheim is hope, bringing hope, right? Because as PTs, when we work with our patients, a lot of it is we're giving them hope, right? We're giving them hope they're going to recover from their injury and they're going to move forward. They're going to restore their function that they had. They're going to be able to do the things that they did before they had whatever injury or condition they were coming to see us for. And that's important in an organization as well. As a leader, right? You have to have the ability to inspire. You have to have the ability to give hope to the folks that are following you, the people that you're leading, so that you can ultimately achieve the goals of the team, of the organization. And so we'll talk a little bit about that. And I think that's something that is easy to overlook, but it's also a very much a core competency of what we do as PTs.
Yeah. The phrase that I don't know if I realized before I was in PT school, maybe I just had no concept of failure and just decided I was going to do something, was imposter syndrome. I feel like something's been brought up that sort of has been brought up a couple times. Like, hey, I didn't realize I was allowed to be here. I know I've thought that and said that several times. How do you coach others or self-coach yourself through that, since you are, as one of the friend of my podcast, Rebecca Griffith, says, using familiar skills in a non-familiar place, which is great for me, especially because I get to come tell the same jokes I told for 15 years in radio, and they're all new here because no one's heard these gags, right? So how do you coach yourself or others through maybe some of those feelings? Lindsay, you're already nodding. We'll start with you.
Oh, sorry. Yeah. This is kind of my bag. That's what I spoke about at Congress earlier, or I guess last year now, 25, on imposter syndrome. So really to break it down, because a lot of people might not know what imposter syndrome means, even though the phrase is thrown around, but really it's the inability to believe that your success is deserved. You'll hear phrases commonly like, I was just at the right place at the right time, or I've tricked them. Or they're going to find me out. I really don't belong here. But I would say to start coaching yourself and others through imposter syndrome is to really do a deep dive on who you are as a person, to understand what your strengths are, what are your weaknesses, and owning those things. And so actually during this session, because we have 90 minutes, We're going to be inviting the attendees to engage in their own personal SWOT analysis. So looking at strengths, weaknesses, opportunities, and threats. And for me personally, when I come into a space, I know what my strengths are and I know what my weaknesses are. And I own my weaknesses before anyone else can own them for me. And so I might come into a space and be like, hey guys, I'm really good at this, this, and this. But hey, Kelly, I see you're really strong here. That's where I'm going to need a lot of support. And I own that. I think that shows a lot of that you're reflecting on yourself, that you're self-aware, and you can turn those weaknesses into strengths by kind of shining a light on them. And I think when you do that, others are more likely to share their weaknesses too. So then you're really building like a sustainable solution rather than all kind of putting up fronts and being like, yeah, we know what's going on, but you're not really getting into like a deep conversation on the problem at hand and how we can build a best solution forward. So that's how I would coach myself and others through, is by that SWOT.
Yeah. Kelly, let's go to you. What's the focus? What's the story? What's the thing you hope people walk away from your portion?
I don't know about it. I don't know that it's specifically just from my portion, but I hope that that the PTs in attendance walk away just kind of thinking about other things they might be able to do outside of strict clinical positions, but also that recognizing that the skills of the people in the room are needed in leadership spaces, that they bring value to those spaces, that they bring diversity in perspectives, the experience, and the lenses that they look through. And I think, in healthcare leadership specifically, we always like to see leaders that have been in clinical shoes before.
Why? Why is that valuable? I think I know, but I want to hear why you think that, because I agree.
Again, that perspective of the practicing clinician, those coworkers on the front lines, providers, therapists, kind of, again, shifting and thinking away from spreadsheets and what looks good on paper and what makes sense on paper to what actually translates to real practice. Yeah.
Other things that we brought up in the intro and that you can find when you're perusing your APTA app, which you should download beforehand. This way you can, I feel like there's three types of people. We're recording this in January. I'll probably release this. I like to release it maybe a week before people get on the plane. This way they have something to download while they're flying. There's three types of people. People who already know in January what sessions they're going to on what day. I can be friends with those people, but I am not that person. There are people who decide on the flight, and there are people who decide 4 minutes into a session. And I am the second or third, depends on that day. But as we mentioned in the session highlights, emotional intelligence, courageous conversations, that's really what you're going to highlight. Is there a story that, I don't want you to give away the whole thing, but we can do a movie trailer version. Is there a story where those skills made the difference in your own leadership journeys that maybe you bring into, or maybe you haven't thought to bring to the presentation?
So I can jump on this one if you're throwing down the puck. So for me, my kind of origin story with working through imposter syndrome was when I attended a program through the Army, which, plug for people interested in serving in the Army, lots of additional education opportunities, endless career advancements. You're in leadership roles before you're ready, but that's where a lot of growth happens. So if that piques your interest, hit me up on LinkedIn. Would love to discuss your future career in military medicine. But I was in an MBA MHA program in 2019, and I remember the first day we were doing introductions, and one guy stood up and was like, I'm just here to learn what all those providers are doing all day. And I'm like, excuse you, sir. You know what I mean? Like, we're the ones actually doing the work. So I just knew that my voice could add value to those spaces where we didn't have seats at the table. And, I'm sure Kelly's experienced this, and she was discussing this, where it's like, those people in the rooms making the decisions that impact us on the front lines of healthcare. And we're like, who the heck came up with this dumb idea? And they don't know how that actually translate into actual clinical practice. And it's like, we need to get seats in those tables, in those rooms. So that was really put a fire under me to where I'm like, no, I belong in this space. And yeah. I'm going to bridge that gap between that. So I don't know if that's answering your question, because now I've just worked myself into a tizzy, but I get really passionate about the topic.
I get it. I mean, I get brought into situations. My mom said it best when I was trying hard to explain what I wanted to do that didn't exist yet. And I sort of had the elements, and she just put it together. She said, you speak 2 languages fluently. So I had been on the creating, I hate the term, like content, right? I've been communicating for my whole life. And then I've been a clinician and went through PT school and been in the clinic. And now I was in the room full of marketers, for lack of a better term. And I'm saying, hey, I see what you're trying to do, but no PT would ever say that, or they would never do that or look at that, or that's a stock image. I don't know what you're trying to do there. But then on the other side, I could walk in through a room full of clinicians and I'm like, I see what you're trying to accomplish. That's not the way if we just streamline it down. So I am able to jump between those 2 rooms. And I feel like that's sort of the core of what all 3 of you were saying, which is, you take those familiar skills. I can't not look through the lens of a former radio DJ. Sorry, did it for 15 years. Like, you can't take that. You can take the guy out of the studio, but how do you yes and that? And that's a multiplier, right? That's good. I mean, you can't get 15 years of radio experience. You can't get military clinical experience in a weekend course. You can't get it on a Netflix of CEUs. You can't do it, and that's terribly valuable.
Yeah, it's so accurate, as to be able to be in that space, to have the experience as a clinician, to have been on the front lines and work with the patients, and then to elevate into the leadership space where you can truly multiply your impact. And for me, day to day, like, that's the thing that I get excited about in leadership, and why I enjoy what I do and I stick with what I do. Don't get me wrong, I love seeing patients. That was something that I truly enjoyed, be able to have that impact one-to-one. But when you look at leadership, at least for me, it's this opportunity to expand that impact, to have a greater impact, help more lives potentially through what I do, through how I lead my team and lead my organization. And that's what gets me excited, is taking what I was doing before, taking those skills that I built, and then leveraging them in a different way to have greater impact.
Now, this isn't imposter syndrome. So this question, I'm not even sure what the term would be, but I felt sort of like guilty that I said I was going to be a PT. I went through school. I graduated. I promise I have the degree. I passed all the tests. I got the little license somewhere around here in a file. And then I was going to do this not standard PT thing. I was going to leave the clinic after 2 years. And I sort of walked around looking for permission. And as we all know, we know this. You don't really need it. This is how this world works. You sort of just run around and do whatever you want within reason. Did any of you face that too? Or am I the only weirdo who was like, I sort of really want to do this other thing, but I feel sort of guilty for looking my colleagues or classmates in the eye and being like, hey, remember that thing we were all going to do? You're going to do it, but I'm going to do this other thing. And I still feel that to this day, 10 years later.
I absolutely had that whenever I transitioned into a leadership role. I think, especially after doing it for 15 years and so focused on pediatrics, it was a little part of my identity. So I did feel that guilt. I'm not sure who that guilt was directed towards, but definitely felt that. And then I had my kids in my ears, the past decade plus saying, Mom, you're not really a PT anymore. But I am. So totally have felt that, and lots of ways I can rationalize that. And I think, like others, the way the fulfillment I get is that I am supporting many other PTs as well as many other disciplines doing the work that they do. One of the biggest parts of my day is blocking and tackling, right? So that they can be successful in what they're doing frontline, bedside, at the mat, in the gym with the patients.
Yeah. You're doing the thing that Lindsay was just talking about. Like, who designed this? Where was the person with the voice of the clinician in the room when this was being decided, and why are we doing this? Kelly, it sounds like you're in that room making sure before it leaves and before the decision is made that all angles have been heard and thought about.
Doing my very best.
Yeah. Yeah, that whole phrase, if you're not at the table, you're on the menu. And I would say, well, go up, be in the kitchen, because that's where it happens before it actually makes it to the table. And that's a great way to start to think. Maybe this is just me. I graduated in 2016, so it's been 10 years. I feel like it's either happening more or we're just hearing about it more. I'm excited about either. I hope it's happening more and we're hearing about it more. But Todd, for you, do you see more people, more PTs, more of us stepping into places where we typically aren't?
I think so. And I think we certainly hear about it more. There's social media out there. There's the LinkedIn's and so things like that out there that make it more visible. But then I think if you look at CSM sessions, for example, and you sampled that, I recall when I first went, I don't know, 2012, something like that, it felt all very clinical. It was all this very linear clinical path. And now I feel like when you look at the sessions, there's much broader things that are being presented. There's much different discussions. And so I think there's some of that happening too. We are seeing the opportunity. We're seeing the roles that we can fill beyond graduating and going to the clinic. And don't get me wrong, my wife practices full-time in the clinic. It's very noble. We need those folks, right? We need those folks that are going to do that, because that's the core of how we're going to interact with folks in the community that we serve. But we also need folks that are going to do things beyond that. And there's going to be a balance.
Yeah. All right. Let's. I'll ask the same question. We'll go Lindsay, Kelly, Todd is the batting order. How do you approach CSM? You're going there as a presenter. You're going to do your 90 minutes, right? But you're hopefully going to go to some other sessions. I'm always curious how other people decide. Like, I've been both. I've been the guy on the plane a day before, and I've been the guy 5 minutes before saying, "Did the session just start? Where should it be?" How do you pick? And then what if anything? You don't have to give me a specific session, but what are the ingredients of something that excites you in terms of a title or details of a session that makes you want to jump in?
Definitely catchy title is what's going to get me, but I'm not going to pretend like I'm actually going to look at the thing before I get there. I don't even know if we're signed up yet. Like, I'm very confused with how all this works, but I know it's all going to be okay. Todd's keeping us alive with, getting everything submitted on time. He's been really keeping us together. So everyone can thank Todd for our session when it kicks off without a hitch. So thank you, Todd. So I haven't looked at any of the sessions, but I think for me, how I'm going to drive this is just by focusing on building relationships and meeting people there and talking to them. Hey, what sessions are you going to? And kind of that word of mouth thing. Cause you can only read so much into a session when you're reading the description, but really if it's like, oh no, this session's going to be awesome. For me, right. I don't think I'll focus more on the more technical, clinical related sessions as much. Like, I'd be more interested in the leadership policy things, which kind of brings us back to the last question of like, we got to get in that room, and that's so we can advocate for our profession. Like, we wonder why like our reimbursements suck, which I'm honestly not even that familiar with coming from the military sector, but I know more broadly that's a huge issue. And we wonder, well, like why don't we get good? It's like, well, because we need to build those leaders that can get to those tables and advocate for what we do as a profession. And that's a huge translational gap that we need to be really intentional about filling. And I think the APTA is working deliberately in that space because they see the importance of it. So I think that's why, this leadership session was picked up for an on-demand webinar where people can view it, who aren't even attending CSM in person, because they see the value in curating those leaders from our field.
Yeah. And kudos to the Academy of Leadership and Innovation. And if you're, I try not to assume that people listening understand how deep and how wide APTA is. Listen, love it or hate it, there's a bunch of PTs who are doing a lot of work behind the scenes. I wish we could shine a light on a lot more of the work, but the Academy of Leadership and Innovation really does do a lot of those things that Lindsay was talking about in terms of content. Kelly, how do you approach this? Lindsay just said, hey, you got to write a catchy title. Give me something to sink my teeth into. What are some of the things you look, and how do you try to like sort of, mix up your bag before you leave CSM to make sure you got what you needed to get?
Yeah, so I'm typically sort of naturally drawn to anything that in that catchy title says we're going to show you how to be a better leader and how to better serve the people that you lead. And so I have to be pretty cognizant to, like you said, mix it up a little bit. Yep. Do some of the things in we'll say Todd's realm that are not my forte. So kind of the more technical AI advances, so that I can at least follow the conversations whenever I'm in the rooms with those conversations happening. And then, being pretty far removed from hands-on clinical work, I do try to attend some sessions that, kind of keep me up to speed on what the clinicians are doing as well.
So far, if you're keeping score at home, 2 points for marketing in terms of write a great title, and you can do that however you want. Todd, how about you? How do you approach this? The first time I did it 10 years ago, I said it's a circus with 18 circuses inside of it. So it can be overwhelming. How do you approach CSM?
So I always try to get something that I'm not doing in my day. That's my first rule for CSM. It's so broad. There's just so many different sections, and just the breadth of knowledge and the breadth of practice we have in physical therapy is really incredible. And so I've always, when I've gone to CSM, I'm going to try not to go to an ortho section. So like, sorry, ortho folks, you have great work that's going on, but that's what I lived in for years. I want to go see a neuro session or peds or something that's different from what I do every day. Because for me, I think that's where you can generate a lot of ideas. Can we cross-pollinate here?
Yeah.
Is there something that you're doing over there that maybe I should be applying in my world or in my treatment? And so that's how I approach it. I basically look at the things that I do and look at them to see if there's something particularly interesting that I want to do. But then I go look at all the other sections and say, what's there? What can I learn that's really novel or different? And almost try to find the things that are furthest away from what I'm doing in my day-to-day.
Yeah, I always found it interesting or unique or I don't know, sort of like the opposite. It's called the combined sections meeting. We come together and then we all separate into these little sections. I'm like, wait a minute. You got a bunch of people who have a bunch of differences that can learn from each other, but we're all hanging out in the same room with each other. 2 questions left. We'll do this one question, then we have the parting shot. This for all of you. Feel free to jump on it. What's one thing you hope PTs actually do differently after your presentation at CSM or this conversation? What's something? We'll start with Lindsay because you gave me the nod. You gave me the nonverbal.
I'm just always nodding. I don't know.
You're always going to get called on. You knew that in class.
The one behavior change I would want our attendees to make is to raise their hand when given an opportunity to impact their clinic, their organization, their practice more broadly. So I always say, never close the door on yourself. And I feel like a lot of times we use diminutive languages where we're like, oh, I'm just A, or I'm only A, or I've only been practicing this long. It's like, hey, well, you bring a lot of insight to the table that you're discounting severely. So if it's one thing that they could take away is to understand how their clinical practice can translate more broadly, as we've discussed ad nauseum, which it's still a very exciting topic and really kind of the meat and potatoes of our topic discussion. But the behavior change would be that they're more apt to raise their hand.
Yeah. Lindsay, how that's my least favorite word. I'm a word guy. Just. It sort of diminishes and minimizes everything that's going to come after what you're about to say. So it's, I hear that a lot with PTAs. And I've said before, you say that again, I'm going to throw you out of the room. You can't say just. You're a PTA. Say it, mean it, finish it, right? Kelly, what are your thoughts? What is your hope of a change after someone leaves the room with you guys?
I think kind of tagging on to what Lindsay said, just walking away from the conference, from hopefully our talk, realizing the leadership skills that you already possess. And even if you have no desire to ever go into an official role with a leadership title, you can be a leader within your clinic. You can be the one who takes students and educates them and shows the rest of your fellow PTs how to be good clinical instructors. You can be the one who brings change to your setting. You can be you outside of your clinical practice. You have the skills and the knowledge and the capabilities to step up and affect change.
All right, Todd, no pressure. You got to follow those two.
They're making it hard for me. But I think what I'll say is just looking at us, look at the 4 of us on this call right now, and we're all trained as PTs. We all have PT degrees, and we are doing vastly different things, but we have a core common skill set that we developed through our clinical training. And for me, I would love folks to walk away and say, I have this fantastic set of skills that I can leverage to do a wide variety of things. And that's on me to then go out and discover what it is that I'm going to do with that set of skills I possess.
Yeah, it's in the show notes, but I'll give you the nuts and bolts too. Saturday, February 14th, Leading with Care, Developing Physical Therapists, Potential in Healthcare Leadership, bright and early at 8 a.m. That's smart, though, because most people are coming from the East Coast, so 8 isn't so early still, a couple days into CSM. And just this is a public service announcement. If you have a significant other and realize that you're going to be at CSM on Valentine's Day, plan ahead, order that thing, get it delivered. I speak from experience, everybody. We've fallen into that trap before. It's on the way. I promise. I ordered it. It's being delivered. All right. The last thing we do on the episode is called The Parting Shot.
This is The Parting Shot. One last mic drop moment. No pressure. Just your legacy on the line.
No pressure, just your legacy on the line. You can repeat something you said before. Favorite quote, doesn't matter. We'll go in the batting order. Lindsay, Kelly, and then Todd. What's your parting shot, Lindsay?
You belong at the table, but bring your own chair.
Like it. Kelly, what do you got? Parting shot. I think we got you muted.
Sorry about that. Parting shot. Take your phone off mute.
All right, thanks. No, just kidding. Oh, and then go ahead. Say what do you got? What's your parting shot? All right, we might have lost her. Todd, save it.
So I'm going to borrow from Warren Buffett. Invest in yourself.
Love it. All right. In the show notes, the details, the information, however you want to plan ahead, peruse, I don't know, cheat code, Command A, copy, paste into ChatGPT after you give ChatGPT what you're looking for, what you're not looking for, and maybe it will spit something out for you to go. It's better than my old way of figuring out, which is throwing darts. So I will be on site. I've just heard there's a rumor there's going to be chocolate, so I'll be on site for your presentation. Thanks for doing this, and thanks for doing that, what we will see in Anaheim in just a couple of weeks. Thanks so much, guys.
Thank you.
That's it for this one, but we're just getting warmed up. Smash follow, send it to a friend, or crank up the next episode. Want to go deeper? Hit us at ptpintcast.com or find us on YouTube and socials at ptpintcast. And legally, none of this was advice. It's for entertainment purposes only. See, Keith, we read the script. Happy now?